Happy holidays and Happy New Year to everyone, to you and your family. This year we're giving you all a fitness box to promote health and wellness, which I think is really important to me, and I know it's important to you. And in the box has some interesting things like some exercise bands. And furthermore, I recorded a series of videos where you can watch how to do some exercises which I think are really good for your overall posture. I think anyone can do them. They help to relieve tension, whether it's in your back or hips or your shoulders. They help to maintain good posture in your neck. These are great things to do and will hopefully help you have a healthier and happier 2023. One of the things that we can do with these bands are squatting exercises. Squats are really good because they get your hips extended. You also get to build strength in your buttocks and also not only in your quadriceps but in your hamstrings. And it's really important to try to build hamstring strength up because our quads get overly taut, overly tight, and it can also pull our hips out of place. So we need to keep the back areas getting stronger so that we don't end up with spinal problems. So you can do a squat, either a normal squat, or you can put a resistance band across your leg. But I'll just demonstrate a normal squat because it's essentially the same thing. So we want to have our feet parallel. In addition to that, we want to make sure that we're putting our weight through our heels and actually squeezing our buttocks because we don't want to be too much on our toes. And when we do a squat, we want to kind of look forward, not arch our back too much, and as we get proficient and get stretched out, we can actually go all the way down and you can kind of come close to sitting on your heels. But again, when you go down, squeeze your buttocks, put your weight through your heels, don't lean too far forward, and that'll help you do a successful squat. I'm showing you how to stretch your hamstring and your hips. So you take the band and you put it around your foot and you can apply a little more tension and try to pull your leg back. Most people's hamstrings get tight and then it can affect the lower back and produce tightness in the lower back. So in addition to just pulling your leg backwards to stretch in here, we can also get a further stretch by putting our leg out this way and helping to stretch the groin. In addition to that, we can switch hands and let our leg fall this way and stretch our hips and glutes out and put our arm in the opposite direction and turn in our opposite direction to give our spine a little bit of a stretch as well. And then you can kind of go back and forth with this, just moving smoothly, making sure you don't make any sudden jerky movements that could pull a muscle. And obviously we can do the same thing with our opposite foot and help to stretch our areas of our body out and stay limber and stay healthy. Often I see patients that have a tilt in their pelvis. These could be patients that have hip problems, often they have lower back problems, they could have knee problems and foot and ankle problems, and sometimes these patients can walk with a limp, and the limp may be due to the tilt in their pelvis. I can tell you, in doing regenerative medicine for over 23 years, I don't think I've ever seen a patient with lower back pain that does not have a tilt in their pelvis. The patient may not know it, but it's there, and helping to reverse this tilt, which we do through prolotherapy, can be very helpful for the patient. But there's some other things that the patient needs to do as well, and they involve a ball and the wall. So part of the reason why the pelvis gets tilted is having too tight of an iliotibial band. And our quads and iliotibial band get too tight and our hamstrings aren't strong enough to compensate for this. So what we need to do is to take the ball, put it right above the knee, and then twist this way, essentially kneading the ball into the iliotibial band and trying to push it forward. And we knead for a few seconds in each area and slowly move it up the hip until we get to the point of the hip. It may be painful, especially when the iliotibial band is tight, but unfortunately you have to persevere a little bit of discomfort to help to make your body progress. So keep doing it till you get around here, and I would try to do that at least once a day. If you're a cyclist, you may need to do it more often because cyclists' hips get very, very tight. Believe it or not, most patients, it's much more important to do it on the left side than the right side, but there's really no reason why you can't do both sides. So that's one important thing. The second important thing is to try to open up the front of the body and try to loosen the psoas. And we do that by putting our left leg back, right leg forward, and reaching up in the air. and arching back, thus stretching out the entire muscular chain in here. Again, this is a really important stretch to do if you have a tilted pelvis, have back pain, have hip problems, or have knee problems, and it helps to get your pelvis realigned and helps to stretch the muscles to get overly tight that lead to the tilted pelvis. Sitting at a desk, having poor posture leads to our chest being tight. Furthermore, if you're into weightlifting, many people develop their chest more than they develop their back. And this leads to all different types of problems with the shoulder and also with the neck. So when we see people that have a forward shoulder or their shoulder keeps dropping, one of the most important things we need to do is to loosen the chest muscle. Now, this is a lacrosse ball, and we give this to all of our patients, and I'm going to show you how to use this lacrosse ball to help this problem. So all you need is a wall and the ball, and you essentially place the ball in between your chest muscle and the wall and just roll around, just like this. And this helps to kind of massage that muscle, break up some of the fibers, let them release and let them relax, and helps to get our shoulder into a better position, which is good for the health of the shoulder and of the cervical spine.